What is the prognosis for hepatocellular carcinoma, HCC? Imagine a disease that can be quite silent in its early stages but becomes more serious as it progresses. Hepatocellular carcinoma is the most common type of primary liver cancer, and its outlook depends heavily on how early it is caught, the health of the liver, and the treatments available. When diagnosed early, especially before the cancer has spread beyond the liver, the chances of survival improve significantly. For cancers confined to the liver, about 37 to 30 out of every 100 people live at least 5 years after diagnosis. If the cancer has spread to nearby lymph nodes or tissues, the 5-year survival rate drops to around 13%. When the cancer has spread to distant parts of the body, survival chances are very low, with only about 3 to 4 out of 100 patients surviving 5 years. Detecting HCC early makes a big difference. When caught at an early stage, treatments like surgery to remove the tumor, liver transplants, or thermal ablation can lead to 5-year survival rates between 50 and 90%. Liver transplantation, in particular, offers some of the best outcomes, with about 60 to 70% of patients surviving 5 years after the procedure. Without treatment, the outlook is much poorer. Early-stage patients who do not receive treatment may live around 3 years, while those with advanced disease might only survive a few months. Several factors influence the prognosis. The presence of underlying liver conditions like cirrhosis can make treatment more difficult and worsen the outlook because they limit options and impair liver function. Advances in screening programs, especially for people with chronic hepatitis B or C infections, have helped detect cancers earlier, giving more patients a chance at curative treatments. Over the past decade, new techniques such as radioembolization and improved surgical methods have also contributed to better survival rates. Looking at the prognosis based on the stage of the cancer, very early stage cancers have a high survival rate, with 70 to 90% of patients living 5 years after treatment. Early-stage cancers have a 5-year survival rate of about 50 to 70%. For intermediate stages, more than half of patients can survive more than 2 years with treatment. Advanced stages tend to have a median survival of 6 to 12 months, and terminal stage cases often see survival around for months due to severe liver failure and widespread cancer. In summary, the outlook for hepatocellular carcinoma varies widely depending on how early it is diagnosed and how much the liver is affected. Early detection through regular screening for high-risk groups and access to treatments like surgery or transplantation can greatly improve the chances for long-term survival. However, once the cancer advances or liver function declines significantly, the outlook becomes more limited. It's important for patients to work closely with liver cancer specialists to develop personalized treatment plans that can optimize their chances of better outcomes.